Okay, I'm going to talk about my book here. This is called Prevent and Reverse Back Pain by me, Pete Rogers. Picture of the painting Pilgrimage to Canterbury on the cover there. Right in the beginning, I go right to the table of contents. I always either start the book with something fun, like some jokes or some quotes, or I'll go to the table of contents real fast because all people ever see really is that little preview on Amazon. It's at Amazon.com. Is I want them to see that there's going to be something valuable to them right away or something funny. I'm trying to make a declaration in a sense that my books are not like other books. And I've been told, and I know it's true, the same things that make my books good also make it impossible for them to ever be allowed in a school, which I find is funny, which shows you how bad the schools are. If anything that makes a book good is not allowed in a school. Oh, you can't have jokes. Oh, you can't have religious paintings. Oh, you can't criticize conventional medicine. So there's a disclaimer. It basically says this is educational purposes only. I'm not your doctor. I'm just a mope who spends all his vacation time writing books because I have nothing else to do. Luckily, most patients are too lazy and stupid to read and follow my advice, which is good because otherwise Big Pharma would probably kill me. Okay, so here's a painting of Copernicus in his Conversation with God by Jan Matejko, the great Polish artist. It's Copernican inversion to realize the main cause of back pain is not disc herniations due to trauma, but spine degeneration due to poor diet, lack of blood flow, atherosclerosis, leaky gut, and toxic chemicals that weaken the spinal ligaments like fluoride, caffeine, alcohol, tobacco, and probably glyphosate. Okay, so here's the first chapter, and it starts out like this. It's called Ischemic Spine Theory of me, Pete Rogers, Dr. Rogers. Now I know that an author is never supposed to spill the beans in the first chapter, but I want people to know that I figured out the spine. And I know you're probably too cheap to buy the book, so I'll give you the quick summary in this Amazon preview. Bazillions of patients get MRIs of the cervical and lumbar spine looking for big disc herniations, but I seldom see that. In over 90% of cases, I see degenerative disc disease, DDD, and related findings like diffuse idiopathic skeletal hyperostosis. Why? Because the disc and the vertebra are alive, and they are trying to protect the spinal cord and the nerve roots. That's the key point there. The spine's job is to protect the nerve roots. Just like your skull protects your brain, the bones of your spine protect your spinal cord and your nerve roots. Everything they do is because of that. The disc is alive and it normally runs on anaerobic glycolysis, atherosclerosis from high-fat diets, and vasoconstriction from high-sodium diets, as well as psychological stress, sleep deprivation, and hypertension, diabetes, and caffeine. They all decrease blood flow to the disc. The lack of blood flow causes the disc to crack. The outer part's like a steel-belted radial tire, the annulus fibrosus. When the disc fails, the vertebra starts to wobble. You get abnormal motion. That's called segmental instability. 2 VBs and the disc in between is a segment. When you've got segmental instability, the spine, it has proprioceptors that sense abnormal motion. And once it detects that, it'll set into play a process of growing bone to fuse those segments. If this wobble persists, the spinal cord and nerve root will be damaged and the patient will die. So because of that, the vertebrae above and below start growing bone spurs towards each other to fuse the abnormal motion across the abnormal disc space. Okay. Ralph Waldo Emerson quote, "The fox has many tricks. The hedgehog is only one trick, but it's the best trick." So the spine can only do one thing, fuse that disc space so that the abnormal motion will stop. Now it is the abnormal disc that is out of commission, and the vertebra above and below it become fused. And this then puts increased weight on the VB above it and the VB below it, okay? So they undergo, subsequent to that, accelerated degeneration. So it's called accelerated adjacent segment degeneration. And because of that, it'll walk its way all the way up to the skull, and it'll walk its way all the way down to the sacrum. So the entire spine becomes fused. It's called autofusion of the entire spine. I see this all day long, every day. These are these old people. They walk kind of hunched forward. We call it the grocery store position, like they're pushing a grocery cart hunched forward. Okay. A fused spine is frail and stiff, and it's painful. This is your typical middle-aged guy and older patients hunched forward, and little old ladies with the hunched back. They have a fragile, weak gait. The posterior paraspinal muscles become atrophic, so they can't get their back up into good posture. They can't get the flag up But it's much worse than that. The spine is also held together by, scaffolded by ligaments, and ligaments are primarily made out of collagens, the protein. And it's a triple helix, so 3 protein fibrils wrapped around each other. Okay, and every third amino acid in collagen is glycine, the smallest amino acid. The ligaments are weakened by fluoride, by caffeine, alcohol, tobacco, and apparently glyphosate, which is on non-organic food, and a lack of vitamin C, which is mostly in fruits and vegetables. And these are all common in modern Westerners. Weak ligaments predispose to spinal segmental instability with subsequent degenerative disc disease and diffuse idiopathic skeletal hyperostosis. Usually we just call it DISH, and a fused spine. Okay, how can I be so sure I'm right? I'll go into all that next time, but I'm just letting you know, me, Pete Rogers, Dr. Rogers, I'm the best expert in the whole world on the spine. I figured out the entire mechanism of spinal degeneration. I just explained you the overview real quick, but I'll go into much more detail on how it all works. And the relevance of knowing this is, once you understand what's going on, there's lots of things you can do to minimize it and decrease your symptoms of back pain and neck pain. So it's good to understand it. What happened was I tried getting a grant. They refused to give me a grant, funding agencies, and then I tried publishing it in the journals even without a grant. They would not publish it. These journals, they tend to be owned by big pharma. They're also sometimes owned by the big manufacturing companies that make the hardware to put in the spine with spine surgery. And some of them, are pain management, where they do all the steroid injections, epidural steroids and all that. So none of them wants people to know about this diet and lifestyle stuff being related to back pain. So they wouldn't publish the journal. I was pissed off. So I wrote the book. And then I wrote a previous book version of it, an earlier version of it, that was black and white, because I didn't know how to do illustrations or color illustrations in the past, but now I do. So the current book's much better, and it's much bigger and much expanded since the old version. Anyways, I hope you found this helpful.